So the first thing that I'll have you do is just say your name. I'm Dr. Victoria Bodendorfer.
Nice job.
And I'm a family medicine resident at Gunderson.
Okay, perfect. So I'm Dr. Victoria Bodendorfer, and I'm a family medicine resident here at Gunderson.
Let's do it one more time, just like you're introducing yourself. It looked like you were kind of looking back and forth.
Okay,
Like
so
we just
just
met.
look
Nice
at
to
him.
meet you.
Okay,
Yeah.
all right. So hi, I'm Dr. Victoria Bodendorfer, and I'm a family medicine resident here at Gunderson.
Why don't you tell me why you decided to choose Gunderson for your residency program?
Sure. So I met Dr. Kloss at one of the national conferences for family medicine as I was deciding to choose where I wanted to go for my practice. And he definitely convinced me that this was a great place, and everything I would say, having been here now for about 3 years, was absolutely true. He said that it was a great place that really focused on medical education, that cared about their employees, a place that would really listen to you as a resident even, and that's definitely held true in training. On top of that, I knew that it had a great reputation. I'd asked many people if they knew about Gunderson and found 0 people that had anything bad to say about it.
So when you were ranking, and I don't know about the entire process.
Mm-hmm.
So when you're ranking places to go, did you put Gunderson at the top?
I put Gunderson at number 1, and I was very excited when I matched here.
Ooh, that's great. So you were the first class to come through. Did you have any concerns about being the first group of residents in a brand new program?
Sure, absolutely. Everybody I think would, because every program being new could have kinks or things to work out, as you might expect. I went to Medical College of Wisconsin for my medical school training, and I was the first year through a brand new curriculum, which was a little rocky at times, but I felt very comfortable. And so the fact that I still put Gunderson at number 1 is saying something, because I felt very comfortable that the program really was going to listen. I asked Dr. Kloss many questions about how they were going to do things before I came here, and everything was well thought out. And I felt like you weren't going to fall through a crack. If there was going to be a problem, it would be fixed right away. And being the first class through, of course, there are little kinks, but they listen to our feedback extremely well. And so I feel very good about that.
So did you have any experiences, or have you had any experiences as a resident, and they've really made you think, like, I made the right choice coming to Gunderson for my residency?
Yeah, there's many days I've listened to some of my friends that have gone to other programs, and I think we are really lucky here. We have things that I don't think other programs have. One of them being like the student or resident housing. That just shows that they care about the residents to put campus housing right here next to the hospital. I think they look at our hours a lot more carefully and try to make sure we're not violating duty hours more than other programs when it comes to call and things like that, which means a lot to a resident because you don't feel like you're just a workhorse. I also see that everybody knows you as a resident. So, as I've been here 3 years, I think you can walk through the house, someone will always say hi to you, whether it's the CEO of the hospital or whether it's maybe even a janitor. I think or a cafeteria person, everybody, and the environment's so positive that way. Plus the faculty has been great. So, there's a lot of positive things here that I'd say I was really lucky when I got a place here.
That's great. We hear time and time again, all the residents talk about the housing.
Yeah.
Everybody likes it, I guess.
I'm just going to have you brush your hair.
Oh,
When
sure,
you kinda nodded
absolutely.
like that, it fell a little bit.
Awesome.
So we hear about the Gunderson method of teaching, or the Gunderson training didactic. So in your words, do you feel like you're getting a better education here at Gunderson than maybe what you've heard or know of other places?
I would agree with that. I think that they focus on trying to do more individual learning than maybe other places. So when you're on a rotation, maybe like on OB or in the ER, they try to have just one learner on so you can be the only person that they're focusing on instead of having 5 residents and you're just one of many that they're trying to teach. So I think that makes a huge difference in the way that Gunderson does it. And they even do that for students, which I think is definitely different than what I got as a medical student. So you can see it all the way down from that level.
How do you feel about Love Plus Medicine?
Love plus medicine, I think that's a really awesome phrase, and I think Gunderson definitely does have it. I think that the way we treat patients here is very focused on their experience more than just how can we get as many patients in and out of the hospital. So I think that that's something that we do try to strive as an institution, and I think that that's makes a big difference for the patients and for providers, like fulfillment in that care.
So you're almost done with your program. You're going to be a clinician in the system. So what does that mean to you? Like, you've obviously, something has kept you here. You're not originally from the area.
Yeah. So it was a big choice for me to stay here versus go back home, which is near the Milwaukee area. And so what drew me here, again, I've loved my experience. I love the people that I work with. I know what it's like having been a medical student through many institutions down in the Milwaukee area. And it just doesn't compare. I've interviewed at other places, and nothing quite compares to the Gunderson system. And so I'm really excited to stay and be here with a lot of people that I would call more of like a second family on this side of the state. And just to know that I'm in the institution, I know like what I say actually will be heard and listened to, and we do really care more about the patient experience.
So what do you think you're looking forward to the most working in your new position?
Well, that's a hard one. I'm really looking forward to being able to continue to work with some of the people that I know are so close to me and that taught me. And so I'm excited that I'll still be able to have that connection with those people. And also, I'm really excited to be part of like a new position where I get to work not only in the clinic, but also work with the residency program as an attending on their family medicine residency service. So it allowed me to kind of keep full spectrum in a way, doing inpatient and outpatient work, which you don't find in many places without having to do it on top of your clinic. Whereas here they were willing to give me a whole week where I'm away from the clinic and just focusing on the inpatient. So I think that's really neat.
That's great. So some of the people at this event may have given a gift in support of the family medicine residency program. If you were face-to-face with a donor, what would you say to them?
I would definitely thank them for everything they've done to help this program get going. I'd say that all of the efforts were definitely well worth it. Looking at the time that I've had here, I think I've got a great education, and I think that they're really going to be proud of the way that the program has been running, and making great physicians that want to stay in the area and allowing family medicine residents to see how great Gunderson is.
Can you tell me a little bit about what you think the future of primary care is, and how Gunderson is making an impact of primary care in our area?
So I think the future could be very undecided in a way. I think we're definitely moving toward trying to make it as easy as possible for patients. So we're looking at doing e-visits now and telecommunication and all of these different aspects of care. And Gunderson's definitely trying to take a lead on that. They're already trying to teach the residents how to do e-visits, telling us about all the things that are possibly coming so we can be prepared, which I think is definitely something that we appreciate. And so I think family medicine is going to really transform as to maybe even doing more care from the clinic, but have people being cared for almost in their home. So I think that's going to be maybe a huge change. But I also think that primary care is really becoming more important than it ever was in the past. So Gunderson's really focusing on training you to be the best primary care physician that doesn't just pass things off to a specialist, but knows how to take care of it themselves. So I think that, we're changing a lot, but all for the good. And Gunderson's definitely preparing us for that.
I mean, I feel like I could ask any question and you'd have a perfect answer.
Yeah,
and we have so much wonderful stuff. Do you ever this is amazing. What you're sharing is if I scripted it, you were saying it. Yes. And you even said you like low cost medicine. So.
Yeah.
Awesome.
I'm just trying to think if
Do you have anything that you would like to share?
Yes, they should know. Let's see. Whew. I mean, I do. There's a lot of things. I think the questions help me come up with things as I'm not come up with them, but think of them. I think I'm sure Dr. Kloss talked about 3 out of 4 staying here. I think that's a huge piece of, importance here. Sorry, that's mine.
Going on. Okay.
It should be. Sorry.
That's all right.
Let's move it. All right. I mean, the area, this depends. Like, I don't know exactly what you're looking for. If it was a recruitment thing, I'd say the area is awesome. Like, the area here that we're in is a beautiful area that we get to experience. Gunderson's Family Medicine Residency program's focusing on wellness more, and I'm on the wellness committee. So looking at that, I don't think other programs do that. We're really working hard on trying to make sure that our residents are acknowledged for how much work we do, and trying to take some of our lecture time and make that what we call wellness time. So team bonding, hanging out, taking a break from all the lecture and the grind of things so that we get that little bit of break that helps make a difference and makes you really feel like people do care about you and they understand you're working a lot of hours, and that, that's what residency is about, but how can we make that better?
So if you had the power to say one thing to a group of people that could potentially have the ability to grow the program even more, what would you want to say to them?
That's a hard question. I'd want to say, this is a great training program. I have not heard or seen one like this, and so if we were going to grow something or make an experience for more incoming residents, a real positive one, it'd be really awesome to have Gunderson be even larger. And I'd say that I think a lot of people would rank this program and would come here. I think there's a lot of people that wish they were able to come to Gunderson, and unfortunately, we only have so much space.
Can you do that one more time, but look at me?
Yeah. Oh, yeah. Sure. Sorry.
Yeah. I liked what I feel like, they would be connecting, looking at you and saying,
sure,
here's more money.
Sure.
But
right.
just say it one more time.
Okay. Can you ask me the question again?
Yeah. So if there was one thing you have the power to tell all these people something that is going to inspire them to help grow the program, to have more residents and be bigger and take care of more people, and what would you tell them?
I'd tell them that I think that would be a really great thing, because this program is really special. It's very unique, and you don't get this type of experience at most places. And I know that there's lots of people that interview every year, and I think that many people would love to have this experience and would definitely come here. I think there's lots of people that interview and wish or have ranked Gunderson highly and are disappointed they didn't get here, and their experience isn't quite probably as positive as this one. So you'd be bringing out more residents through this great environment.
Excellent.
What is it about the rural experience for you? And when you answer, look at Brady. But why rural? Why Wisconsin? Why here?
Sure. So I've always wanted to do more, or at least be trained in full scope practice to give you that opportunity to do everything, which could be and usually means rural medicine. And so I think that you definitely have that here, where you get a good education in OB-GYN, where I don't think you get that everywhere. You get a good education in the ER if you wanted to do ER. You get a good inpatient medicine experience, which kind of fulfills that full scope. And I think that's really important. You will even get great experience doing clinic procedures, which, again, all that fits the full scope practice. And so I wanted to go to a program that would allow me to feel confident in those skills leaving. And so I think those are all really important, and Gunderson's a great job trying to fulfill that. I'd also say that they really do a good job trying to show us what rural medicine is by sending us out to a rural site for a month. I've also done a rural month in an ER at Toma, which is considered more rural. So you've got opportunities to go other places too. We're also doing a surgery month now, moving more forward to doing a rural surgery month. So I think they do a great job trying to give you that experience and give you those skills to practice anywhere you want.
Great.
Fantastic. I think we
Awesome.
got it.
Perfect.
Awesome.
Yeah.